Question 1. What suffix is used to indicate a surgical removal or excision? A. Ectomy. B. Itis. C. Ossis. D. Plasty. Answer: A. Ectomy. Rationale: the suffix ectomy refers to the surgical removal of a part or all of an organ or structure, such as in appendectomy, removal of the appendix. The other options do not indicate removal. Question 2. Which suffix refers to a condition or disease? A. Ossis. B. Algia. C. Oma. D. Graphy. Answer: A. Ossis. Rationale: the suffix ossis indicates a condition, often abnormal, such as in sclerosis, hardening of tissue. The other suffixes represent pain, tumor, or process of recording. Question 3. What does the suffix itis mean? A. Pain. B. Inflammation. C. Tumor. D. Removal. Answer: B. Inflammation. Rationale: the suffix itis indicates inflammation, such as in arthritis, inflammation of the joints. The other options do not denote inflammation. Question 4. Which suffix means pain? A. Algia. B. Ectomy. C. Ossis. D. Itis. Answer: Algia. Rationale: the suffix algia refers to pain, as in neuralgia, nerve pain. The other suffixes refer to conditions, removal, or inflammation. Question 5. What does the suffix oma typically indicate? A. Pain. B. Tumor. C. Condition. D. Inflammation. Answer: B. Tumor. Rationale: the suffix oma refers to a tumor, typically benign, such as in melanoma, a type of skin cancer. The other options do not refer to tumors. Question 6. Which suffix refers to a procedure involving imaging or recording? A. Scopy. B. Plasty. C. Graphy. D. Otomy. Answer: C. Graphy. Rationale: the suffix graphy refers to the process of recording or imaging, such as in radiography, X-ray imaging. The other options refer to visual examination, surgical repair, or cutting. Question 7. What does the suffix plasty mean? A. Surgical repair. B. Tumor. C. Pain. D. Inflammation. Answer: A. Surgical repair. Rationale: the suffix plasty refers to surgical repair or reconstruction, such as in rhinoplasty, surgical repair of the nose. The other options do not refer to repair. Question 8. Which suffix is used to describe a surgical opening? A. Otomy. B. Scopy. C. Ectomy. D. Itis. Answer: A. Otomy. Rationale: the suffix otomy refers to the surgical cutting or opening of a body part, such as in tracheotomy, surgical opening of the trachea. The other options refer to other procedures or conditions. Question 9. What does the suffix ectomy refer to? A. Cutting. B. Removal. C. Tumor. D. Disease. Answer: B. Removal. Rationale: the suffix ectomy indicates the removal or excision of an organ or structure, as in appendectomy, removal of the appendix. The other options do not relate to removal. Question 10. Which suffix is used to describe a narrowing or constriction? A. Stenosis. B. Itis. C. Ectomy. D. Scopy. Answer: A. Stenosis. Rationale: the suffix stenosis refers to the narrowing or constriction of a passage or opening, such as in angiostenosis, narrowing of blood vessels. The other options refer to different conditions or procedures. Question 11. What does the suffix centesis mean? A. Surgical removal. B. Surgical puncture to remove fluid. C. Inflammation. D. Tumor. Answer: B. Surgical puncture to remove fluid. Rationale: the suffix centesis refers to a surgical puncture to remove fluid, such as in amniocentesis, removal of amniotic fluid. The other options do not refer to this procedure. Question 12. Which suffix refers to the process of breaking down or dissolving? A. Lysis. B. Ossis. C. Algia. D. Plasty. Answer: A. Lysis. Rationale: the suffix lysis refers to the breakdown or destruction of a substance, such as in hemolysis, destruction of red blood cells. The other options do not refer to breakdown. Question 13. What does the suffix pathy indicate? A. Disease or disorder. B. Tumor. C. Pain. D. Removal. Answer: a disease or disorder. Rationale: the suffix pathy refers to a disease or disorder, as in neuropathy, nerve disease. The other options refer to pain, tumor, or removal. Question 14. Which suffix means excessive flow or discharge? A. Rhea. B. Plasty. C. Algia. D. Ossis. Answer: area. Rationale: the suffix rhea refers to excessive flow or discharge, as in diarrhea, excessive bowel discharge. The other options do not refer to discharge. Question 15. What does the suffix scope mean? A. Surgical instrument. B. Viewing or examination instrument. C. Removal. D. Tumor. Answer: B. Viewing or examination instrument. Rationale: the suffix scope refers to an instrument used for visual examination, such as an endoscope, instrument for visualizing the interior of the body. The other options do not refer to an examination instrument. Question 16. Which suffix indicates a process or condition? A. Ossis. B. Ectomy. C. Itis. D. Plasty. Answer: A. Ossis. Rationale: the suffix ossis indicates a process or condition, often abnormal, such as in cirrhosis, liver condition. The other options refer to surgical procedures or inflammation. Question 17. What does the suffix algia mean? A. Pain. B. Tumor. C. Surgical repair. D. Inflammation. Answer: A. Pain. Rationale: the suffix algia refers to pain, as in myalgia, muscle pain. The other options refer to different conditions or procedures. Question 18. Which suffix means a disease or abnormal condition? A. Ossis. B. Ectomy. C. Plasty. D. Itis. Answer: A. Ossis. Rationale: the suffix ossis is used to indicate a disease or abnormal condition, such as in tuberculosis, disease caused by bacterial infection. The other suffixes refer to inflammation, removal, or repair. Question 19. What does the suffix ad indicate? A. Toward. B. Condition. C. Removal. D. Tumor. Answer: A. Toward. Rationale: the suffix ad means to or toward, as encephalad, toward the head. The other options do not convey this directional meaning. Question 20. Which suffix refers to the visual examination of the inside of the body? A. Scopy. B. Otomy. C. Ectomy. D. Plasty. Answer: A. Scopy. Rationale: the suffix scopy refers to the visual examination of the inside of the body, such as in laparoscopy, visual examination of the abdominal cavity. The other options refer to cutting or surgical repair. Question 21. Which suffix means blood condition? A. Aemia. B. Ossis. C. Itis. D. Ectomy. Answer: aemia. Rationale: the suffix aemia refers to a blood condition, such as anemia, lack of red blood cells. The other suffixes refer to conditions or procedures unrelated to blood. Question 22. What does the suffix gen mean? A. To produce or generate. B. Tumor. C. Pain. D. Removal. Answer: A. To produce or generate. Rationale: the suffix gen refers to something that produces or generates, such as in carcinogen, a substance that causes cancer. The other options do not imply production. Question 23. Which suffix refers to a condition of the skin? A. Derma. B. Algia. C. Itis. D. Oma. Answer: A. Derma. Rationale: the suffix derma refers to the skin, as in dermatitis, inflammation of the skin. The other suffixes refer to pain, inflammation, or tumors. Question 24. What does the suffix AC mean? A. Pertaining to. B. Tumor. C. Pain. D. Inflammation. Answer: A. Pertaining to. Rationale: the suffix AC means pertaining to, as in cardiac, pertaining to the heart. The other options refer to different medical conditions or procedures. Question 25. Which suffix refers to the formation or creation of something? A. Poiesis. B. Itis. C. Ology. D. Plasty. Answer: A. Poiesis. Rationale: the suffix poiesis refers to the formation or creation of something, as in hematopoiesis, the formation of blood cells. The other options refer to inflammation, study, or surgical repair. Question 26. What does the suffix phobia mean? A. Fear. B. Tumor. C. Disease. D. Inflammation. Answer: A. Fear. Rationale: the suffix phobia refers to an irrational fear, as in arachnophobia, fear of spiders. The other options do not refer to fear. Question 27. Which suffix refers to a surgical repair or reconstruction? A. Plasty. B. Otomy. C. Ectomy. D. Itis. Answer: A. Plasty. Rationale: the suffix plasty refers to surgical repair or reconstruction, as in arthroplasty, joint replacement. The other options refer to different procedures. Question 28. What does the suffix side mean? A. Killing. B. Tumor. C. Pain. D. Condition. Answer: A. Killing. Rationale: the suffix side refers to the killing of something, as in pesticide, substance used to kill pests. The other options do not refer to killing. Question 29. Which suffix refers to the process of examination or inspection? A. Scopy. B. Otomy. C. Plasty. D. Ectomy. Answer: A. Scopy. Rationale: the suffix scopy refers to the process of visual examination, such as in colonoscopy, examination of the colon. The other options refer to different procedures. Question 30. What does the suffix graph mean? A. An instrument for recording. B. A condition or disease. C. Surgical repair. D. Inflammation. Answer: A. An instrument for recording. Rationale: the suffix graph refers to an instrument used for recording data, such as in electrocardiograph, instrument for recording electrical activity of the heart. The other options refer to conditions or procedures. Question 31. Which suffix means incision or cutting into? A. Otomy. B. Ectomy. C. Plasty. D. Itis. Answer: A. Otomy. Rationale: the suffix otomy refers to making an incision or cutting into a body part, such as in laparotomy, incision into the abdomen. The other options refer to different procedures. Question 32. What does the suffix site mean? A. Cell. B. Tissue. C. Tumor. D. Pain. Answer: A. Cell. Rationale: the suffix site refers to a cell, as an erythrocyte, red blood cell. The other options refer to tissue, tumor, or pain. Question 33. Which suffix refers to the removal of fluid? A. Centesis. B. Ectomy. C. Otomy. D. Plasty. Answer: A. Centesis. Rationale: the suffix centesis refers to a surgical puncture to remove fluid, as in thoracentesis, removal of fluid from the chest cavity. The other options refer to different surgical procedures. Question 34. What does the suffix stasis mean? A. Stopping or controlling. B. Inflammation. C. Tumor. D. Pain. Answer: A. Stopping or controlling. Rationale: the suffix stasis refers to stopping or controlling, such as in hemostasis, stopping the flow of blood. The other options do not refer to stopping or controlling. Question 35. Which suffix refers to the enlargement of an organ or tissue? A. Megaly. B. Emia. C. Algia. D. Itis. Answer: A. Megaly. Rationale: the suffix megaly refers to the enlargement of an organ or tissue, such as in splenomegaly, enlargement of the spleen. The other options do not refer to enlargement. Question 36. What does the suffix sclerosis mean? A. Hardening. B. Tumor. C. Removal. D. Inflammation. Answer: A. Hardening. Rationale: the suffix sclerosis refers to the hardening of tissue, as in arteriosclerosis, hardening of the arteries. The other options do not refer to hardening. Question 37. Which suffix refers to the surgical fixation of a part or organ? Apexy. B. Ectomy. C. Otomy. D. Plasty. Answer A. Pexy. Rationale: the suffix pexy refers to the surgical fixation of a part, as in nephropexy, surgical fixation of a kidney. The other options refer to removal, incision, or repair. Question 38. What does the suffix phage mean? A. To eat or swallow. B. Tumor. C. Inflammation. D. Cell. Answer: A. To eat or swallow. Rationale: the suffix phage refers to something that eats or swallows, as in macrophage, a cell that engulfs pathogens. The other options do not refer to eating. Question 39. Which suffix refers to the destruction of something? A. Lysis. B. Osis. C. Ectomy. D. Algia. Answer: A. Lysis. Rationale: the suffix lysis refers to the destruction or breakdown of something, such as in autolysis, self-destruction of cells. The other options do not refer to destruction. Question 40. What does the suffix tomi refer to? A. Cutting or incision. B. Removal. C. Tumor. D. Disease. Answer: A. Cutting or incision. Rationale: the suffix tomi refers to the act of cutting or making an incision, such as in tracheotomy, incision into the trachea. The other options refer to different processes. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.